Okay. Good evening, everybody. I, Dr. Avni Skandan, welcome you all on behalf of Kerala IRIA for yet another session of this different out-of-the-box session that we are trying to do right now. It was started by Kerala IRIA as an extension of our Women's Day celebration. We had one session which was dealing about face yoga, and this session is about our general physical health, physical training, especially that is targeted towards radiologists. And the reason being that Kerala IRI is running with the belief that it's not just the academics, but we need to have a wholesome health, a wholesome growth. Also, well-being is very important. So that is what we are targeting, and that's why we are coming out with these kind of sessions. And for this, so to start off the session, first of all, I would like to thank Kerala IRI to be able to give us a session, give us a chance to encourage people into something like this, to go into a different path than the regular academics. So first of all, thank you so much, Kerala IRIA. Thank you, Gomati ma'am, our president, who is not with us right now for the session, and our secretary, Dr. Rijosa. Both of them are very supportive and are always allowing all these kind of different things, whether it be a cultural growth, whether it be sports related stuff, whether it be physical well-being, they are supportive of everything. So I thank both of them, because as leaders they're showing us such a great path, because of which everybody is into the same swing, everybody wants to go in the same direction. And I welcome Dr. Ramesh Chinai sir, who has been our backbone through every event that is being done, any event that we do in Kerala IRA. He is there supporting and directing and executing each and every of our events. So I welcome you, sir. And most importantly, I welcome the audience and our expert of today, Dr. Neha Tol. I'll give you the bio that she has given me at the start. She has a bachelor's of physiotherapy from DES College of Physiotherapy, Pune, master's in sports physiotherapy from DY Patil, Mumbai, worked with Jupiter Hospital, Mumbai and Thane District Football Association. She is the founder of Control and Control Physiotherapy and Fitness Clinic in Thane. She has done a certificate course in vestibular rehabilitation, mat pilates, and I think I pronounced it wrong, kinesio taping, and spine manipulation. So that bio has been provided by her. It's a very impressive one, but I will tell you my experience with her. I was a part of a session that she conducts every day morning. It's exclusively for radiologists. She has a session every day morning exclusively for radiologists. And there's a lot of radiologists from all over India who are attending those sessions. And the thing that I probably am one of our most irregular students, to be very frank, because I always end up not getting up in time. But what I've noticed is, based on our work habit and our work culture, I had a facial instability and a lot of issues, a lot of radiating pain, compression, a lot of nagging pain, which has been with me for long. But from the time that I've started attending her sessions, miraculously, even though I've been irregular, I have actually got rid of that pain. I feel that muscles are strong. I definitely feel that I have got a, what do you call, strength. The muscle strength building is what she's targeting on. And that when you see her sessions or when you attend her courses, you will understand the kind of muscle strength. And in fact, every time I see the sessions that she does, the thing that I remember is she tells us to take these certain postures. And I will be stunned and looking at her. Our body will be shaking and vibrating, but the way she maintains her posture, that is a kind of control that, with her practice or with her technique she has got. So I really hope that this kind of technique is going to help all of us. So she does have a regular training sessions. She'll be talking about that also. She actually wanted all of us to keep our cameras on so that she can monitor each one of us. Unfortunately, this is in webinar mode and we cannot do that. But you can always have a separate session with her, have a go and see how she does it. And she's very, very, very patient with everybody. So I'm sure she'll tell you more about herself, about her sessions, and then you will see directly what she is going to be teaching us. So hopefully you all will find this session useful. So over to you, Dr. Neha.
Thank you so much, Dr. Avni. Thank you so much for such kind, words and for the appreciation. And I'm glad I could help you with it. So first of all, I would like to thank everybody here, and I would thank you for your sincere efforts that you have been taking as a practitioner in the field of healthcare. So because as a healthcare professional, we usually tend to neglect our own health, And today I would like to speak about the health of our own professional as a healthcare, as a radiologist. So what all problems you can face in the practice and doing your regular work. So we are going to take care of that. So we are going to see the work related hazards and how to prevent those problems. So if I would share screen and just we can start with the session. So if you could just help me with the screen share.
1 minute. You can share actually. You're the panelist. Just click the green button down, share screen option.
Yes. Is it? Can you see the screen?
Yes, I think I can. Yeah, you have shared the
Okay.
yeah Zoom thing. Yeah.
Okay.
No. Do you have a PPT or something to share?
Yeah.
Now we can see only your Zoom screen right now.
Neha, you just share your PPT alone. Select your PPT instead of the entire screen.
Okay. Okay. Is the screen still now?
No, we can't see your PPT. Just can you share the just close all the other tabs and just open your PPT.
Is it okay now?
Yes. Yeah. Yes, Neha. Yes.
Okay. So let's go ahead with it. Audible and clear. So is it okay now?
Yes, Neha, it's seen. You can put it
Yeah.
in presentation mode and start it.
Yeah. I've put it in. Okay. So topic is the health related hazards in radiologist. We'll be targeting the musculoskeletal system. So with every profession, there are different professional demands that come with it. So these professional demands, sometimes they go away from your normal neutral position and are different from your regular body alignment. So these things, they can cause certain injuries in the musculoskeletal system. So it is a multifactorial injury or multifactorial disorder per se. So these factors related are activity specific, that are how much force are you exerting in a specific activity, repetition throughout the day, or awkward sustained posture or contact pressure. Also, apart from the activity, person's lifestyle and personal susceptibility are important factors that come along with it, and which make you prone to injuries. So impact of health related disorders, when we speak about radiology, these injuries can range from minor discomfort and also end up into a career ending injury. So this is why being aware of these injuries and preventing them in first place is most important thing. So according to survey, we're going research based, McCann et al. In 2001, he surveyed 308 interventional radiologists regarding their musculoskeletal system, out of which 84% reported aches and pains in neck and back. So commonly affected areas are the neck pain and back pain, like even Dr. Avni mentioned some time back that she had symptom in the neck. So that makes one. So 84% reported that they have pain and ache. Most subjects attributed the pain to be work related activities. That is, it is due to the activities you're doing throughout the day has caused you certain pains and aches. Now, what are the factors or what are the...
Are you, one second, sorry, are you changing your slides because we are stuck at the first slide?
Yes, I have switched.
We are
to
still
the
not seeing it in the the presentation mode. I am seeing it only as work-related hazards in radiologists.
Now, can you see it?
You will have to go into the presentation mode, I think.
Can you see the next slide now?
Yeah.
So it's you can see the impact related disorders.
Yes, we can.
Okay, so that is what I was talking about. So these factors that are causing risk and make you more prone to injuries, that is the female sex, BMI greater than 25, practice length greater than 10 years. So when you move ahead in your practice, you are more prone to injuries because the posture has been sustained throughout the years. You have been doing same repetitive activity, and that has caused the muscle adaptation. Another very modifiable factor is your BMI. So it's the weight is beyond the body image. Weight, ideal, maintaining ideal weight and muscle mass. It matters more for your health concern, and it's not just the way how you look at it. So this is a very important factor, and we all have to work on it. So these are the factors that can lead to musculoskeletal pain, especially in the field of radiology. Also, with increased digitalization, the hours that we've spent in front of computers have been increased tremendously. Also, the pressure of reading more cases has been increased, and all these factors, lead to stress that is mental as well as physical stress. So both these factors impact and they affect your physical state. So mentally, if you are stressed, it affects there's increased burnout. It is a psychological state which affects and that further reduces the work performance. Also, physiological injuries such as back pain, low back pain. So it gives you some disturbance in your activity level, your diagnosis, interpretations, and that in turn hampers your performance. So sustained sitting, when you're sitting for a longer period of time in a deviated posture, it's deviated from your normal posture. So there are some changes that happen at the level of the bones and muscles. There's some adaptation that happens. So first thing is the forward-headed posture. There's increased cervical lordosis. So if you see, the head is pushed forward from the normal alignment. The cervical lordosis is increased. The arch of the neck is increased. Then there's increased thoracic kyphosis. That is, the back is slouch, like most of the time you're slouched sitting. So that is how the bone and the muscles are adapted. So what happens is this leads to imbalance in the mobilizers and the stabilizers. So there are two group of muscles. One is the mobilizers, one is the stabilizers. So what the mobilizers do is they move the joint, and what the stabilizers do is they hold certain muscles, they stabilize the joint. So what happens is When the stabilizers are affected, the function is taken over by the mobilizers, and that is why there is all imbalance in the structure. So as you can see in the image, there is this is called a cross syndrome, upper cross syndrome. So what happens is the neck flexors are inhibited, and the back muscles, the rhomboid and the serratus anterior, they are inhibited and they move into atrophy and weakness. So what the serratus anterior and rhomboid does is they hold your back straight, they hold the shoulders in alignment. When the rhomboid and serratus are weak, they lead to protracted shoulders. So shoulders are tipping forward and there is slouch posture. Also the neck flexors are inhibited. Then there's tightness of pectorals, and also the upper traps and the levator scap are tight. So this is how the upper cross syndrome works. And when you think about the posture correction, or you think about treating injuries because of the posture, so because of work related injuries, these factors have to be really taken care of. This is how the management of the posture related injury should be because of the upper cross syndrome. So next very important thing that usually is missed is the proprioception. Proprioception is the sense of the joint position. Okay, so the receptors, they send some impulse to the central nervous system, and we are aware of how we are sitting in the first place. Okay, so I have a joint sense if I'm sitting slouch, if I'm sitting straight. So that is the joint position sense, and that is called the proprioception. So with impaired posture or the adaptability that the muscle has, the proprioception is affected. So now I am really not aware of the way I'm sitting or the way I'm walking. So what you can do is just to review of how the posture is, and to be more aware of the posture, you can just look in the mirror sideway and just see if the shoulders are rotated forward, if you have a slouch back, and are you walking with the same posture, which means the proprioception is affected, and you have not really thought about this affected proprioceptive sense. Okay, so this happens with if this happens over the years when you're sitting sustained in forward-headed postures. So next, there's a new concept called mobility, which is actually different than flexibility. Usually what happens is the mobility is confused with your flexibility. So first I'll explain what flexibility is. Flexibility is a static stretch. So when you hold the muscle in a lengthened position, it is called flexibility. Mobility is actually moving the joint throughout the range of motion. Okay, when you actually move throughout the available range, or if you can, sometimes what happens is you have passive range, but there is a lack of active range. Now I can just demonstrate how it goes. So when I rotate my neck to one side, okay, you all can also try doing it. When you rotate your neck to one side and give a slight over pressure, you see that there's some passive range available into it. Okay, but that we're not able to actively do it. Now, when you start practicing this passive range, the proprioception is improved, and now you can have the complete control of the available range of motion. So once you get this, proprioception is improved, the joint position is improved, and the range and strength of muscle is improved. There are advantages that we, can get injury prevention. It is a very effective kind of warm up when you actually start exercising, because then you put the joint into the end range positions. Also, the technique of exercise is improved. So it is not just limited with the head and the neck. If you are doing a squat and coming up, so if the mobility of hip, if the range available at the hip is better, then you are able to squat better. So this is how the mobility works, and there are different mobility exercises, and they are sorted with every joint. There are different exercises. So we focus on specific joints, and also we focus on the combined movements. That is how the concept of mobility is. Next thing is the ergonomics, the how the work setup is, how your sitting posture is. So we all have several times seen the ergonomic chair, but my takeaway point on this will be you have to be more stronger, or the muscle strength has to be better to actually sustain this type of sitting. Otherwise, what happens? We are so engrossed in our work. We are always, behind doing investigations, interpreting, and then you're not really aware of how you're sitting. So we know that this is ideal, but how much can you sustain the sitting position? So what you can do is you can just prepare the body, strengthen the joints like we saw in the upper cross syndrome. You can stretch specific muscles, strengthen specific muscles, and with such approach, you can actually sustain a good posture and prevent injuries. Okay. So these are my top 5 exercises for posture correction. So I just demonstrate this exercises. Okay, so you can just do it when you're sitting. So I'll just show you all these 5 exercises, or we can just do it at the end of the session when we stop the screen share. So these are top 5 exercises that you can do every day, and we'll record it at the end. Next is our fitness training. So regular fitness training, we all know that it is most crucial, and it is like a hygiene habit that we have to develop. Like the certain hygiene habits like taking a bath, brushing your teeth. So doing regular fitness training has to be a hygiene habit. Okay. So there are many advantages of the aerobic and strength training. So both these type of exercises have to be really combined when you're doing a regular fitness training program. So intensity. Now, how much exercise you have to do, it varies from person to person. So there is a scale called box scale. So what the box scale shows is it's your rate of perceived exertion. Okay, how tired are you at the end of the session? It is subjective. It will vary with me and you. So everybody's level of exertion is different. So it has to be graded according to your own level of fatigue. So you start with 0 to 10. Okay, 0 is no fatigue at all, and 10 is the maximal level of fatigue. So you have to have intensity somewhere between 5 to 7. Okay, this is your own rated level of exertion. So you have to have intensity between 5 and 7 when you're doing aerobic exercises. Aerobic exercises will include walking, cycling, all these exercises which increase your heart rate. So they all come under aerobic training, and you have to monitor them on intensity of box scale. This has to be your intensity when you're doing any aerobic training. So determinants of fitness training, these are specific pointers on which you have to really focus. So first is frequency. How many times you're supposed to exercise throughout the week? So ideally it is recommended that 3 days of strength training. So strength training will include resistance training, training with dumbbells, therabands, or body weight training. So putting in some resistance on the muscle, that is the strength and the resistance training, and 2 to 3 days of aerobic exercises. The session has to last around 40 to 45 minutes. Intensity is like we saw on the box scale for aerobic, and for when you're doing the resistance training, it has to have some overload. So if you're starting with 2 kg dumbbell initially, you cannot just continue with 2 kg. Once you're comfortable doing that, then you have to add on weight to it. Then you have to progress. Okay, so even that progression will vary from person to person, and there's specificity. So if you're training for a marathon program, so there are specific exercises and specific energy systems that you're supposed to train for marathon running. Okay, example, marathon running is a long distance running. So you have to train that system to get a good result. Next is the reversibility. Okay, so reversibility is once you stop exercising, there will be some amount of deconditioning that happens over a period of 3 to 4 weeks. So these are the determinants, and that is how you plan a fitness training program. So adaptive curve. Now we have seen how much to exercise, how many times, and all these components, but what we usually ignore is the recovery cycle. Okay, so it is not that you are supposed to overtrain or you're supposed to miss your day of recovery. So certain day you can give it just a rest or do a very mild intensity of exercise. because a good recovery will give you better result than what fatigue does. Okay, so overtraining will never give you results as much as a good recovery will. So this is something you should not miss when you're setting up a good physical fitness training program. So this is how the basic prescription is, that a good diet, good nutrition is always important. Okay, exercise regularly, plan out the exercise program, having aerobic, anaerobic, and a good crafted program. And most important thing is sleep. It is very important factor when you speak about recovery. Also, when you're doing an exercise program, it has to be charted. When you start with warm up, the muscles are warming up, you can do some mobility drills into it. Then your main actual exercise session, and it has to end with some mild stretches. So this is how the exercise program is charted. So we conduct this exercise program called Fit Culture. We conduct it online on Zoom. So we've shared a Google form with you, and if you're interested, then you can join this program. So we have a 6 a.m. batch, 7 a.m. and 8 p.m. batch, wherein we take various exercises. For example, we have strength training, Pilates, mobility, and cardio. So if you're interested, you can just pitch in. And I'll stop my screen share saying that radiologist wellness is recognized as a critical component of enhancing the quality of medical imaging and healthcare. So I'll wish you all the health and fitness, and also I'll demonstrate you few posture related exercise which you can perform regularly, and we can prevent the work related disorders. Okay, so I'll just demonstrate a few exercises that you can perform regularly. So I would advise to do it 2 to 3 times a day. We have top 5 exercises that we have listed into it, and performing 10 to 12 reps is good enough. So first is the levator's cap stretch. As we saw in the cross syndrome, the levator's cap is the tight muscle. So what you can do is just rotate your leg to one side, look down, up opposite shoulder is depressed, and just give a gentle neck switch. Okay, so you can just do this sitting on the chair when you're working. Also onto the opposite side, rotate down and pull down. Okay, so this is the first one. Second one is the T movement. So that also, these all things are done sitting on the chair itself. So T is alphabet T. So arms up, take it out in T shape, forward, back down. Okay, 10 reps, both arms have to be in one line, thumb pointing up, back straight, and they have to go into T shape, back down. Okay, you have to coordinate breathing with the movement. So inhale, exhale, move into T, inhale, exhale. Okay, this is the second one. Third one is the Y, that is the alphabet Y. So taking the thumbs up, move into Y. Okay, 45 degree, forward and down. This is the Y exercise. Third is the shoulder external rotation. Okay, so elbows are at 90 degree, bend and just take it out. Okay, so this opens your rounded shoulders. This is for the shoulder rotation. Just hold for 5 seconds. Come back. Open up. Come back. And last one is the thoracic rotation. So you can hold the back part of your chair, other arm rotated, and just rotate back. Both the shoulders are at one level. Okay. Then to the opposite side, hold the shoulder, opposite arm, rotate back. So all these 5 exercises take into consideration all the top 5 components that can be affected in a sitting posture. So I'll repeat all 5. First one was the levator's cap stretch, neck rotation, look down, overpressure. Second one was the T. Third one was the Y. Next one was the external rotation of the shoulder, opening up the shoulders. And last one was the thoracic rotation. Just rotate, pull up, neck back. Okay, so these are the top exercises that you can perform regularly 2 to 3 times a day. And for more of exercises and strengthening, you can just contact me personally and we can take forward from there. That's it from my side. I'll hand it over to Soumya. And thank you so much for giving me the opportunity of coming here and speaking to you all. Thank you so much.
I'm around right now.
No.
Okay. So first of all, Neha, that was something which we can easily do at our desk as we are working. So that is something, I mean, especially when we are working for long, we tend to get this spasms and strains. And even when we start our day, it starts with a lot of stiffness. So we do not get a free movement, or after doing a few scans, you get all stiff. So definitely this loosens you up. After the whole day of scan, I just now did these things that is already kind of, feeling free. So these are some things which we can practice in the middle of our work also. Something very nice. And definitely for further details, there's a lot more, a lot of other, a detailed postures which we cannot be taken up in such a short span. This is just basic of how a radiologist can practice it during their workplace and work times. And she has also told how it is affecting our health, especially our profession in general. It has been very specific also. All those people who want to know more can definitely go, because I really, with my personal experience, I'm saying it has been very helpful. Muscle strengthening. I'm not saying that it brings down. We always have the focus of weight reduction, but this is. I was like, after I started doing the sessions, I was commenting at home. I did not realize, I kind of forgot that my body has these many muscles, because every single muscle she makes you work them up. So it is really nice sessions, and I found them very helpful. So this, I think we need to prioritize our health, definitely. And thank you, Neha, to bring it so specifically to our profession, to bring it so carefully. Means even we did not realize that when we are doing these postures, these are the particular things, or these are the names that we name it. So thank you for that. It was a very brilliant session, and hopefully everybody enjoyed it and would opt to know more about it also. So thank you so much. Thank you, Neha. Thank you, the audience. Thank you, Kerala IRIA. And thank you, MedPiper team, for providing us with this platform, especially Soumya, because she has been doing the whole background work. I have not looked at that side at all. Soumya has been coordinating with Neha. Everything's gone splendid. So thank you, everybody. It's been very nice. Thank you so much.